now we come to the all-important diagnosis phase. So what I will say is angina, I think we said it in the early part of the video, angina is a warning, it's a sign, it's a symptom that something is not quite right with the blood supply to your heart muscles in the arteries, i.e. you may be suffering from some form of coronary heart disease or CHD. So there I am sat in my doctor's surgery chatting to him about my discomfort pains in my heart when I was mowing the lawn. I did say to him, look, I haven't got private medical insurance. I'm willing to go private and pay for it myself. I self-fund it. So that's what we did. But I guess if you're really that poorly with chest pains and stuff, they're going to whisk you into the accident emergency department and sort you out then and there, regardless of private medical insurance or not, certainly in the UK. So within a couple of days, I was sat in the consultant cardiologist's office telling him what was going on, and basically he took my blood pressure, had a little bit of a chat, and he said to me, okay, there's a number of tests we've got to do to try and work out if you've got some form of coronary heart disease, CHD. So that's what we're going to talk about next. So what he did do before I left, he gave me a prescription and he put me on some beta blockers. Basically that stops the adrenaline sort of giving you that fight or flight syndrome, and it just brings the blood pressure down and it just reduces your heart rate. So my normal heart rate is about 56 or something like that beats per minute, and now it's about 45 or 46 at rest. So that's what the beta blockers do. So they just reduce the blood pressure and the beats per minute of the heart. So the consultant was just trying to protect the heart and just to reduce any stress work that the heart is doing to help it. So that's the beta blockers. Put me on some aspirin. Aspirin reduces the risk of blood clots forming, and these clots could actually block the supply of blood to the heart or indeed the brain. In my case, I have CHD, coronary heart disease. So the benefits for preventing those clots in the arteries actually far outweigh the risk of any potential side effects of taking the aspirin. And indeed, in relation to any of the medication, always feel free to ask your doctor about the long-term side effects of taking any of the medication. He upped my statin tablets from 15 milligrams to 20 milligrams, and all this medication is to try and protect and ease the load on the heart. So that's the first thing that you may find, is that you go onto a load of medication to try and help the heart. So that's what we did there. So that was my first meeting with the consultant cardiologist, Mr. Mitchell, and then we did a series of tests, and let's talk about the tests. Before we have a look at the next test, I forgot to say that my consultant cardiologist did actually also prescribe to me one of these. It is a spray. It is called glycerol trinitrate, GTN for short, because it is a bit of a mouthful. Basically what it does, it opens up the arteries and makes the blood flow easier to the heart. So if you are experiencing any pain, discomfort, then what you have to do is couple of squirts of this. Doesn't taste very nice under the tongue. It will take about 5 minutes or so to do its magic, and then as I said, it just opens up the arteries, just makes things a little bit easier. If that has no effect, after about 10 or 15 minutes, you should seek medical advice. Right, on with the next test. 5 days later, I find myself back at the offices of my consultant cardiologist to undertake my first test. Well, it's actually two tests. So the first one we did was what they call an ECG, or electrocardiogram. So basically that just measures the electrical activity of the heart to see what is going on. So all that involves is me taking my t-shirt off, and then the cardiac nurse put some electrodes with sticky pads on the back of them, put the electrodes around the left breast area here, and then just asked me to lay back, relax. It took about 5 or 10 minutes for it to do its thing. So that was the first test. And then once that was done, we did what they call an echocardiogram. So that is a test using sound waves to produce a 2D or 3D image of the heart muscles and the functions of the valves. From memory, they only attached 1 or 2 electrodes on my chest for this test using those sticky pads. Then they just asked me to lay down and they run the test, and what they do, the cardiac nurse has got a wand, for want of a better word, with some jelly put some jelly on your chest, and then they just move it around, and they're just trying to build up a picture, a 2D, 3D picture, using those sound waves, a bit like if you're pregnant and you go to have your baby checked, they use the sound waves with the thing over the tummy. So that's what they did there. Again, that took about 10 or 15 minutes. So I was laying down for part of that, and then they get you to just roll over onto your side, and then they move it around towards the back as well to get a better overall picture of what's going on with the heart, to build up that good 2D and 3D picture. So that was the first test that I did. All these tests are trying to determine whether or not you do actually have some form of coronary heart disease. Now, in relation to those electrodes and the black sticky pads that are used to attach them to your skin, what I will say is you will more than likely find, if they use the same ones that I used on me, is that you will still have evidence on your skin of the black sticky pads after about 4 or 5 days. They're actually quite hard to get off, even in the shower with a scrubbing brush. Next then, we have the test that I was a little bit anxious about. It is called the exercise tolerance test, and basically it is a test where you go onto a treadmill, and then the treadmill starts at a certain inclination, and then every so often, 3 minutes, it goes up a little bit more after another 3 minutes, etc, etc. Now, the reason behind the test is they want to put the heart under load, so it's kind of an ECG, which we did earlier on, but we were laying down for that one. So, and that was at rest. So that's the electrical activity at the heart at rest. So this one, they actually want to get the heart working, and then they've got electrodes around you. So they want to get the heart working to see the electrical activity in the heart, just to see exactly what is going on. So the test that you do, it's called the Bruce test, an exercise tolerance test. I guess it was Mr. Bruce or Dr. Bruce that designed the test. And here's a little chart here which tells you what the angle of the treadmill is to start with, and then every 3 minutes it goes up a bit more, and the speed of the treadmill increases as well. So it's a world known test basically. So before I went to my general hospital at the allocated time and date to present myself to the clinical investigations department, I had some documentation come through which basically explained what was going on in the test, and they told me to take my normal medication, which we've already discussed, and the only thing really of note that it said is don't eat a big meal when you go to do the test. So I didn't eat a big meal. So when I rocked up to my general hospital, to the clinical investigations department, I had my rucksack, bottle of water, and then I just had a pair of running shorts and a pair of running shoes as well, which I changed into before I went in to see, I believe it was a cardiac nurse. It might have been a doctor, but I think it was a cardiac nurse actually, who then took me through the test, as you will see very shortly. So basically you go into the examination room and you wear what you want to wear, but I would suggest either jogging bottoms kind of thing, shorts, or training shoes. Then they will sit you down on the couch, on the bed, and they'll put all these electrodes on you, again like your ECG, and you wear a belt around the middle. You've got all these electrodes on with those black sticky pads, again those damn pads which leave marks all over the place. Well, they do for me. And then they'll put a blood pressure cuff on as well, and just before it goes up the next stage, you will feel the blood pressure cuff expand, and then they'll take a blood pressure reading from you as well. The cardiac nurse or the doctor will wire all this stuff up to you whilst you're sat on the bed, and then they will just take a reading from you, and then they'll get you to go onto the treadmill, and then basically, as you can see here, you just hold on to the bars. That's just for support. You don't have to grab onto them, and then you just walk, and then every 3 minutes you hear zzz. So the treadmill will go up, and then the cuff for the blood pressure thing, that will stop pumping as well, and they'll just ask you, are you feeling okay? You'll say yes or no, and then after every 3 minutes it goes up a little bit more, and well, you get the idea, don't you? And I went up to about 12 minutes when I did it, and I was absolutely sweating like there was no tomorrow, like somebody threw a bucket of water over me. As you can see on the video, this video here is actually because of my pilot medical. I've done all the tests, I've had the stents fitted, but I've now got to go through all the hoops and the loops to get my pilot medical back. So I'm doing all the tests again, and I understand for safety I have to do all the tests again to make sure there is nothing wrong with me. So this test that you see here, this exercise tolerance test. This is me doing it the second time around, and I did actually find it a bit easier. So the stents have worked. Yee, whoopee. So yeah, but this is exactly what I did the first time round, but I did find it a lot tougher first time round compared to the second time round. So the stents have worked. So I did it for 12 minutes, and then once you finish the test, they stop the treadmill. You then get off the treadmill, sit you back down again on the bed, and then they just let you recover, and they take some more measurements, some more readings from you as well. And that really is about it. The whole thing, I suppose, took about half an hour from going in to walking out. So yeah, I did find it quite tough actually. It wasn't quite running, but it was a very fast walk when I did the 12 minutes. So yeah, it wasn't easy. But if there's people who can't do the tolerance test, I believe that there is you can be given some form of medication just whilst you're seated, and then that will get the heart sort of working to the required rate so they can see what's going on from an electrical activity point of view. Now, in relation to the beats per minute that they're trying to get from you, yeah, it's 220 minus your age, and obviously I'm on beta blockers, so they take that into consideration as well because my heartbeat is slower than normal. So yeah, but it's a tough old test, but the second time round I absolutely nailed it. First time round I found it quite tough actually, first time round. But yeah, it takes about half an hour. But this is another test to try and diagnose what is going on with the heart. And then from there, there is another test. So let's talk about the next test. So we have yet another test for me to do. So about 10 days after I'd done the exercise tolerance test, I found myself back at the General Hospital to do another test, and this one was the cardiac CT scan. And before I actually went for that test, they did actually send me a little document just explaining exactly what was going to happen. But before I rocked up at the General Hospital for the cardiac CT scan, I just had to go down to the hospital about 4 or 5 days before that CT scan and just have some blood taken. And all they were doing was just making sure that I had good kidney function, because what they're going to do when you do the cardiac CT scan is actually squirt some fluid into your veins, and they call that contrast, and then that will show up on the x-ray machine that they're going to use. And I go into a kind of waiting room, and they just asked me to pop on a little gown, as you can see here, looking very trendy. And so what is the CT scan? So I've got all the information here. I'm just going to read it out to you. So a CT scan is an x-ray taken by a specialized machine. CT stands for computerized tomography. Computerized tomography. So that's what CT stands for. And basically it says the machine x-rays your body as you move slowly through the machine. And it looks like a big polo mint basically, but you don't go all the way through it. You only just go into it about so much, and that's all really. This information is used to produce images in slices through your heart. So you have to prepare for the scan. So I've rocked up at the General Hospital to the radiology department, and there's several things you need to do. So avoid caffeine at least 12 hours before the appointment, and drink plenty of water before the scan. So about 1 hour before, you should drink times 250 millilitres of water. That was on my pre-joining notes. Take all your normal medications as usual, and then no food 2 hours before the appointment. And then the next thing, a nurse comes along and then puts what they call a PIVC into your arm here. So it's a needle that's in there, and then when you go into the x-ray room, that's how they inject the dye, the contrast, into the vein via this PIVC, which stands for, here we go, peripheral intravenous catheter. Woohoo! And then you'll sit there, and then they'll call you through, and then you go into a room. There's several other people there, and then they'll get you to lay down, and then if need be, they will squirt some of this GTN spray under your tongue just to give as better picture as possible of what's going on in the heart. And you also get connected up to an ECG, so you'll have a couple of electrodes connected to your chest as well as they monitor the heart rate, etc. So that's it, you are ready to go, and basically you lay there on the couch kind of like this, and they give you instructions. It's all relatively quiet. As I said, there's a few people in the room, and then the bed that you're laying on just goes into the big white polo mint, for want of a better word. And then they just ask you to hold your breath. And when they inject the contrast into your vein, you can expect to feel a little bit of a warm feeling as it flows through your body. And the whole procedure takes about 20 minutes. Once it's done, you get up off the couch and then you go and sit in the waiting room for about 30 minutes just to make sure everything is good. And then what you must do is, over the next couple of days, drink plenty of water to flush your system out of that contrast that they pumped into your vein to take the lovely X-ray photographs. Now, before I left the X-ray department, I did actually have a chat with the doctor. He took me through to a little side room, and that's when I got a little bit emotional, because he said, yes, it looks like you've got coronary heart disease and you've got 2 blockages / restrictions in a couple of the arteries supplying blood to the heart muscle. So yeah, everybody's different. I got emotional internally. I think I had a little bit of a weep, bit of a wobbly bottom lip kind of thing. So I had a chat with the doctor, and then when I went home, I sort of drew a little picture, and I'll put the picture up here. So that was my interpretation of what he said was potentially wrong with me and the coronary heart disease. And then the next thing I did was I went to see the consultant cardiologist at his private suites where I've been before. And so went to see him, and we had a little chat. Here we are then, new day, new t-shirt, and I find myself 3 days after that last test in the offices of my cardiologist, having yet another chat with him. And at this point in time, he's got all the test information in front of him, and he says that angina that you've been experiencing, i.e. the pain, discomfort in your chest when you've been exercising, mowing the lawn, he said that's because you've got coronary heart disease, i.e. the arteries supplying blood to your heart muscle, they've narrowed, and that's causing you an issue, and we need to do something about that. And that something about that is we're going to have to send you to a hospital in England, in a place called Oxford, and the hospital is called the JOHN RADCLIFFE NHS Hospital. We're going to have to send you there for a couple of procedures maybe. So the first one would be a coronary angiogram, and basically that's where it's another test. They put a tube in your artery into the arteries supplying blood to the heart muscle, and then they inject a dye through that tube into the arteries supplying blood to the heart muscle, and with an X-ray machine sort of hovering over here, they'll take some pictures and see exactly where those blockages are. And if they need to do something about that whilst you're laying there in the theatre, they will then put a couple of wire mesh tubes into those restricted, narrowed arteries to open them up and thereby make the blood flow a lot better. Those wire mesh tubes are called stents, and that whole procedure where they do the coronary angiogram and put the stents into your arteries, that is referred to as percutaneous coronary intervention. If I've pronounced that correctly, apologies if I haven't. And they shorten that down to PCI. So that's what he said we're going to have to do, and it would be a wait of between 8 and 9 weeks. However, something did happen whilst I was waiting, so let's have a very quick talk about that. Here we are then, 8 to 9 weeks to go until I have my procedure, and I've got to say I'm actually thinking I'm a little bit of a fraud, and I'll tell you for why. Because I had those 2 incidents of angina, that pain and discomfort, which started all of this off when I was mowing the lawn, and then the day after when I was walking my dogs up a slope, and that's brought on the angina pain, where I scored it about a 7 or 8 out of 10 for the pain discomfort level. And I've got to say, in the 8 to 9 weeks of waiting for my procedure, but more of that a little bit later, I had nothing. There was nothing. I was going down the gym, so I was smashing stuff out down the gym. I was going to circuit training on a Saturday morning, working really hard, and I had nothing. I was taking my GTN spray with me, and I didn't have to use it at all. So it was like, I did feel like I was a bit of a fraud, actually. And the times where I thought I felt something, and it would have only been 1/2 of 1 out of 10 on the discomfort level for angina. But I even then I was thinking, is that my brain saying I should be feeling something? I just don't know. Anyway, to suffice to say, I thought I was a little bit of a fraud. So I was still off work. I'm still on full pay, so I've got no financial anxiety. My mortgage is paid for. I've got no kids going through uni, so financially I'm okay. So that's another worry not to worry about, basically. So yeah, I've got to say, I felt like I was a little bit of a fraud. Anyway, something else happened a week before I went for my procedure. Let's put this on a timeline then, shall we? So we are now about 8 weeks since I last saw my consultant cardiologist, Mr. Mitchell, who said in 8 to 9 weeks' time, you will be going to Oxford to the JOHN RADCLIFFE Hospital to have your procedure done. So that's where we are at on a timeline. So we're 8 weeks from when I last saw him, and we're a week to go before I fly from Jersey to London to then go to Oxford to the hospital to have the procedure. So a week to go. I wake up one morning, and bearing in mind I've never had to use the GTN spray up until this point, although I have carried it around with me everywhere I went, so I've not had to use it though. So I wake up one morning, a week to go, and I have turned into a right old man overnight, walking down and up the stairs in my house. I was out of breath. I was having to 2 squirts under the tongue and give it about 5 minutes, and then it should relieve the pain and discomfort that you are experiencing. And on a discomfort level, it was pretty much like when I was mowing the lawn and walking the dogs back in the early part of the video when all this started. So I would say it was a 7 to 8 on the discomfort level. So I was having to use 2 squirts of the old GTN spray and then give it 5 minutes. It should relieve the symptoms because it opens up all the arteries to make the blood flow easier, I guess. But the downside of this, and it is a side effect, it may give you a banging headache, and it did give me a banging headache every time I use this as well. So just be wary of that. But if the pain and discomfort doesn't go after 5 or 10 minutes, then you should seek medical advice or phone, I would suggest, phone 999 and speak to the ambulance team and tell them what's going on, and they will be able to give you advice or send an ambulance out to you because you may be about to have a heart attack. The thing was, when I used this spray, the pain, the discomfort went after 5 minutes. So I was sort of not too concerned, if I'm being honest, because I knew that, well, the pain was going, but I was literally using it 8 to 10 times a day, and I believe 10 times is the maximum you should be using this per day. If you're using that more than that, then I think you need to speak to your doctor, but speak to your doctor anyway if they're going to give you this to use the GTN spray. So I was using about 8 to 10 times a day, but the pain and discomfort would go after I'd used the spray. So yeah, a week to go. I couldn't walk very far, or if I could walk with the doggies, I was in discomfort. I canned going down to the gym. That was totally off the cards going down the gym. So yeah, a week to go, and yeah, I wasn't very happy. I wasn't very well, actually, if I'm being honest. So the next thing then was to jump on a plane from Jersey, where I live, to fly to Gatwick, get a taxi from Gatwick up to the JOHN RADCLIFFE Hospital in Oxford, where I was going to have my operation, my procedure. And boy, oh boy, it couldn't come at a better time. If you didn't know, the JOHN RADCLIFFE NHS Hospital in Oxford has one of the best cardiac centres in the United Kingdom. It's now been just over 2 months since I first had the pain and discomfort in my chest when I was mowing the lawn. So it's Monday the 5th of August. My wife and myself, we've flown over from Jersey to England, and then we got a taxi after we landed to the JOHN RADCLIFFE Hospital. We'd already been made aware that they didn't have enough beds available in the general ward for the Monday and the Tuesday evening. Potentially it was a 2-night stay. So they booked us into a nearby guest house. But anyway, Monday the 5th of August, we turn up in the taxi to the hospital, and then basically they just wanted to take some blood from myself to make some tests. And I think they wanted to check for the MRSA bug. So that took about 20 minutes or so. Once we'd done that, jumped into the taxi, and then it was a 5-minute drive to the guest house, and we went and had a nice meal. But at that moment in time, yeah, wasn't feeling particularly brilliant. Pain, discomfort levels were about 7 and 8 out of 10, and I was using the GTN spray and walking like an old man. Before I left home, JOHN RADCLIFFE did actually send me all the necessary information for me to read, which told me everything there was to know about the procedure, the benefits, for having the procedure, and I have to say the benefits outweighed the risks, and there are always risks to any procedure, and for that reason I found myself talking to my wife before we left home, and I said, look, if anything goes wrong, which it hopefully didn't go wrong, and it didn't, then you can bury me, burn me. And I made sure she knew where all my pension documentation was, all the passwords were there, just in case something did go wrong. And if I had any organs which could be used, then feel free to donate them to whoever may need them. So we did have that conversation. It wasn't very nice, but we had the conversation because I think it is important just in case something did go wrong. Fortunately, it didn't because I'm here now. But yeah, we had that conversation and I did get a little bit teary. It's now the day of the procedure, so the next day. So I did follow all the instructions that the hospital did send me in relation to food and drink beforehand, what you can have, what you can't have. So 9 o'clock in the morning, we arrive at the JOHN RADCLIFFE Hospital to the cardiac daycare unit, and we are met by a very nice nurse. They show us through to the daycare unit. I think there was about 18 beds or something like that within the daycare unit, people having batteries fitted for pacemakers, that kind of thing. So I wasn't there alone, and we fill in the admission forms, and then I put on this lovely gown, as you can see here, very chic and very trendy, and then the nurse put in what they call a peripheral intravenous catheter into my left arm. Next up then, one of the two surgeons involved in the procedure turned up, and he just took me through the procedure, what it was going to involve. So he said what they would do is make a small incision in my right wrist here on the artery there and feed a small tube catheter all the way through the arteries, and then it will then go into the heart artery, supplying blood to the heart muscles. And then once that's in place, they will then squirt a special dye into the catheter, and then with an X-ray machine they'll take some fancy pictures of the dye as it's working its way through those arteries, supplying blood to the heart muscle, and they'll be able to tell where the narrowings or the blockages, restrictions were in those arteries supplying blood to the heart. And that procedure alone is called a coronary angiogram. So that's the first thing they would do, is just work out where exactly the blockages were and a course of action. The next thing he said that they would do, they would then put a balloon through the incision all the way up through the artery into the blocked area of the heart, pump the balloon up. That would then open up the narrowed blocked artery, thereby improving the blood supply, doing away with your angina symptoms, and that's known as a coronary angioplasty. And then if it needed some extra support, they would then put in a couple of wire mesh tubes, metal wire mesh tubes, and that procedure is called stenting, but the flash name for it is percutaneous coronary intervention, PCI, percutaneous coronary intervention. Stenting is a lot easier to say. So yeah, they would stent the blockage once they pumped it up with the balloon, and then that's basically it. So that is the procedure in a nutshell. At 10:40 or thereabouts, I then walked from the daycare centre into the operating theatre. It was only a walk of about 30 metres or something like that. So I walked into the operating theatre. I don't know how many staff were in there. At least 6 members of staff were in there, nurses, surgeons, etc. Said hello to everybody. And then one of the nurses basically just said, "Who are you? Give me your details," in a nice way. And they asked me what procedure was I expecting to be carried out today. So I guess they were just making sure I was the right person for the right procedure. So once they'd done that, that nurse then gave me 1 or 2 tablets to take. I'm not sure what they were, but if you are a nurse doctor, please make some comments in the comment section down below. I'm sure the nurse did tell me, but I've just forgotten what they were. And then once I said hi to everybody, I then got myself up onto the operating table, laid myself down, and then I sort of laid arms down by my side, and they then put those surgical sheets over the top of me, and then away we go. So first thing they did was then they made an incision into the right artery, but I think they gave me some local anaesthetic on there so I didn't feel anything. and then they put something else in there as well. Can't remember what it was, but I had the other thing in the arm here, and then I just sort of laid there, and then there was a big, I'm going to say 65, 80-inch TV screen on my left-hand side, so I could watch what was going on. And then there was a big arm from the ceiling with an X-ray machine or an X-ray head on it, about the size of a briefcase, and that was being maneuvered around my chest, sometimes blocking the TV screen, so it was moving around all the time. And I think the guys who were in a separate room off of the theatre, they were manipulating the X-ray machine to get the good photos of the blockages once the other surgeon had put the dye into the catheter. So they were all chatting to each other. I just laid there and I was pretty relaxed, actually, not too nervous. And every now and again they would chat to each other, up a bit, down a bit, that kind of stuff, or whatever the surgical speak was. And then they sorted the problem out. So I've already discussed what they were doing. They would put the catheter in, they would inject the dye in, see where the blockages were. So that was the first part. And then they put the balloon in there, expanded the balloon. So there was another nurse pumping air into the balloon and then just pushing the blockage back. And then they would chat to each other again. And then they would decide where they were going to put those metal mesh tubes, the stents. So they were still continually chatting to each other, looking at the screens. And then they put the 2 stents in place, actually in one section of the artery that was blocked. So the whole procedure, I went in there at 10:40 on foot and I left at about 11:40 on foot under my own steam. So yeah, it took, I suppose the procedure itself, you've got the chatting beforehand, etc. So I guess the procedure took about 45 minutes or so, something like that. Was it painful? No, not really. I didn't feel them making the incision into the wrist there. Didn't feel that into the artery whatsoever. The only thing I would say was painful was when they were actually blowing up the balloon, when they inflated the balloon. Because if you imagine, they're actually inflating something and then blocking the artery. So you're reducing the blood flow downstream of the inflated balloon. So there was a point when I was laying there where I became very uncomfortable, got the basically angina, chest pains, and I sort of went, guys, it's about an 8 out of 10 pain wise, which is what I was having before. So they said they would give me something for it. Whether or not they did, I have no idea, but yeah, it didn't seem to make much difference. But yeah, that was the only discomfort that I had, was when they inflated the balloon to push the blockage back, and then when they inflated the balloon again to push the wire mesh, the stents, into place within the artery. So that was, it was, yeah, discomfort, 8 out of 10 on the discomfort level, but it was only for a short while. So that would be the only thing that I would say was uncomfortable, was when they actually pumped air into the balloon to start with to push the arteries back, and then when they did the same thing to expand and secure the stents. Other than that, it was fabulous. So there we go. That was an hour from walking in to walking out and having the procedures done, and the procedures that we've just spoken about in the previous bit. So rather than go over those again. So yeah, so folks, I've got to say, it's nothing to worry about, but you may feel a little bit of discomfort in your chest, which is what I had before when I was walking. So yeah, that was it. And the surgeon did say you will feel like a new man. I now find myself back in the daycare unit, and I'm hooked up to a blood pressure machine and a heart monitor as well. The blood pressure machine kept on sounding the alarm because it was going below a predetermined level. I'm on beta blockers, so my heartbeat is about 46 or 47, and it was sounding the alarm off. So the nurse just had to adjust that, but the nurses were absolutely brilliant. So I had some food, that was pretty okay. But I was a little bit tired though. I was now wearing on my wrist where they'd made the incision to put the catheter in, I was wearing what they call a TR band. That stands for transradial band. It's a clear plastic balloon basically that fits on your wrist, and it applies pressure to the area of the incision to prevent any bleeding, etc. So they just sort of pump it up with a syringe, but I've got to say that was really uncomfortable. I didn't like that one at all. That was pretty much up there with the pain that I experienced whilst on the operating table. So you've got that TR band on, and that's doing its job of preventing any bleeding, and then the nurse over a period of time just lets a little bit of air out to reduce the pressure until it comes time to remove the band, which is, I think, was about a couple of hours afterwards or something like that. But I've still got the catheter in the left arm at this stage as well, so I'm pretty much laying there dipping in and out of sleep because I was tired, and I think I was there for about 4 hours. And then the professor who was in charge of the procedure came over and told me how it went. The professor tells me how it's gone. Well, I'm tired, so he's actually chatting to my wife. He did say that they ended up doing another part of the heart and not the part of the heart that they planned to do based on all the results from my tests here in Jersey. Let's keep it simple, shall we? So the heart is a muscle about the size of your fist and needs an oxygen-rich blood supply. There are two main arteries that supply this blood. Here's a diagram. Let's just say that each of the arteries is a tree trunk, and the tree trunk then divides into lots of branches, or in our case, arteries. The two main tree trunks therefore are the right coronary artery, commonly referred to as RCA in medical speak, and then the left main stem artery, or LMS. That's got a nickname of the Widowmaker, as if it gets blocked, it could be fatal, as one of the arteries that branches off it supplies the heart muscle with about 50% of the blood. The professor's chatting to my wife, telling me how everything went, describing what they did and all that kind of stuff. But when you do leave hospital, you will get a discharge summary just like this one here, which is what I've got. And having dived into the discharge summary to see what the professor had put down there, basically what he's put is that, well, here we go. I've just listed it all here. So my left main stem, the LMS, has mild disease, and the left anterior descending artery, LAD, had short severe mid-vessel stenosis. Layman's terms, that means the narrowing of the artery by the build-up of plaque. So we come to the big one then, and that will be my right coronary artery, RCA. So the professor said that had mild to moderate diffuse proximal disease with critical stenosis. I don't like the word critical, but there was critical stenosis in mid-vessel. Now, I've had a look at all that since I've come back. Layman's terms, not brilliant. It means there was a large section of that artery had plaque build-up. So that wasn't brilliant. They did actually check the flow of blood through the artery, and they use a method called, if I can pronounce this correctly, thrombolysis in myocardial infraction. That's shortened down to TIMI for short, and this is a standard method of how they grade flow through the arteries, and they use a scale from 0 to 7. 0 to 2 is a low risk rate of heart-related mortality, and in my case I had a score of 1, which at that time meant I had a 5% risk of having heart-related mortality. So they put 2 stents into the right coronary artery, RCA, to improve the blood flow. This clearly was the more pressing condition and was the one that was causing me those chest pains when I had been mowing the lawn and walking the dogs several months ago. And I'm pleased to say that the professor said that the stenting had given excellent results. Now, in relation to the left tree trunk, or left main stem, LMS in medical speak for short, the professor said that it didn't cause any immediate issues, and at this time no intervention was needed. And then basically what we'll do is just see how it goes in relation to the left side. There is a medical speak for that, which was written down on my discharge summary. The medical speak for, let's just see how that goes, is called bystander LAD, and LAD stands for left anterior descending artery. So that's a bit that they just want to see how it goes. Here's the diagram again. So bystander LAD disease for symptom guided management. And I guess that means if I have chest pains again, then we'll then go and do something about it. That, folks, is the result of my percutaneous, if I pronounce that correctly, coronary intervention, PCI for short, performed by the wonderful Professor Adrian Banning at the JOHN RADCLIFFE Hospital in Oxford. The professor said, with my 2 stents fitted, I should feel like a turbocharged new man. However, things I shouldn't do, I shouldn't drive for a period of 7 days, because basically what they want to do is just make sure in the area of the incision it had time to heal properly. What they didn't want is things opening up and blood going everywhere. And the TR band was removed shortly after I'd spoken to the professor, and the nurse that removed the TR band then put a new dressing on the area of the incision, which I was to keep on for another 24 hours. I was prescribed some additional medication in the form of clopidogrel tablets. I have no idea if I've pronounced those correctly, but those tablets, well, basically because I've had stents fitted, they stop the blood clotting, so you have to take those tablets every day for a year, on top of the other tablets that I'm on, i.e. the aspirin. And the professor also upped my statin dosage from 20 milligrams to 40 milligrams daily, and his aim was to get the bad cholesterol LDL level down to a level below 1.4. And then I was discharged about 4:30, 5 p.m. in the afternoon, and right from the bat then I could notice the difference that those stents had made. There was no chest pain, there was no problems with walking. I did actually feel like a new man. So back to the guest house, we went out for a pub meal, and it was amazing. The change was absolutely phenomenal. I just couldn't believe the change. So yeah, folks, if you've got any doubt about getting the stents fitted, don't go and get them fitted. Every operation has a risk, but boy oh boy, the operation and the benefits far outweigh the risk. So I would just say, yeah, go and get it done basically. So discharge from the hospital, so you get your discharge summary, and then you'll get a discharge advice after your coronary angiogram, angioplasty or stent insertion, PCI. So you'll get one of those, and it just tells you what you should and shouldn't do. And there's some phone numbers in there as well. If you get any issues, then you can phone the cardiac day centre at the hospital, in my case the JOHN RADCLIFFE Hospital. So you'll get those when you get discharged as well. So discharge, back to the guest house, nice evening meal, next day back home to Jersey. Yes, job done. Back home in Jersey then, the transformation, I've got to say folks, simply amazing. I'm a new man, no chest pains, I'm not out of breath. It's absolutely brilliant, and I can't thank everybody involved in my journey enough. Yeah, words aren't enough actually. NHS staff in the UK is superb, and all the medical staff here in Jersey, absolutely brilliant. So yeah, big round of applause from me to you guys as well. In relation to the ongoing journey then, so I come back home to Jersey. Bruising wise, yeah, some bruising on the left wrist, on the right wrist, which lasted about 10 days. So bruising on the right wrist, and again still got a little scar here. I'll put a little close up. So we're now 3 months after the operation, and there is a little scar there. I'm not sure if that will ever go, but the small scab that was on there lasted 10 days or so, like the bruising. And that's about the only thing I have, is that little scar really. In relation to keeping fit and everything, yeah, I'm down the gym now 3 or 4 times a week. I was down the gym previously, but I'm down the gym maybe a little bit more than before. I'm on beta blockers, so that slows the metabolism down a little bit, so that does make weight loss a little bit difficult as the metabolism is slowed down. But since the day of the operation, the naughty draw is gone, and I've lost about 3.5 kilos of weight. Can't you tell? I'm feeling really good actually, feeling really good. So the bottom line is though, I still have coronary heart disease, and we know about the left stem, the left side. There's some issues there. Hopefully with all the medication I'm on and just cutting out the sweet draw and stuff like that, then that's not going to be an issue, and we don't have to revisit that or visit that if I get any pains. Hopefully I don't in the future. So I've got those 2 stents, and I think they're stainless steel actually. So those 2 stents will stay in there forever. Hopefully won't get any issues with them. They won't need replacing apparently. I don't know. But yeah, the bottom line is I still have coronary heart disease. We haven't cured it. We've done away with the signs and the symptoms of angina. but we haven't cured the coronary heart disease, so I still have it. A month after I had the surgery, so we're now September, beginning of September, I popped down to see a cardiac nurse at the General Hospital here, and basically it's just a bit of a follow-up meeting where they just see how you are, and if you want to go to any of the items that they lay on, talks on diet and exercise and all that kind of thing. So they have a plan for you to go and see things if you want. I didn't, because I've done a lot of research on the internet, but there is some aftercare support if you want to know about diet and keeping fit and everything. But I didn't need any of that. But the cardiac nurse, she was absolutely excellent. I told her I was going to make some videos as well of my journey to try and help some other folk out as well if they're a little bit worried about what to expect for the journey. But yeah, a month after my operation, cardiac nurse at my general hospital, quick chat, everything was good. Yeah, see you again. I think she said see you again in another year, but I'm not sure on that, but I'm sure she said we'll see you again in a year. What I will say is over the period from when I had the procedure, in maybe about the first month and a bit, I did experience a little bit of discomfort in the chest. It was almost like I could feel the stents. Not all the time, but I don't know whether something they were just sort of bedding in or whatever. But my wife's got a friend who is a coronary care nurse at the hospital, and she said that is normal for you every now and again to feel like you can feel the stents. So if you do feel like you feel the stents, then that is normal. But any doubt, go and speak to a doctor or pop down to the accident and emergency department and have a chat with them, I guess, if you're that worried about it. There was nothing more for me to say. Now, in relation to the flying bit, I've got to do all the tests that I did before I went to Oxford all over again. And again, I'm self-funding that. I didn't have to self-fund the main operation at Oxford, fortunately, but in relation to getting my medical back, which means I can then fly again, I'm now having to do all the tests again. And the one that really made me realise how much I'd improved is when I did the treadmill test at the General Hospital again for a second time. I smashed that and actually came home and said to my wife, I hope the person in charge of the test had set it at the right levels, because I'd found it fairly easy actually compared to the first time I did it when I had the problem, the angina, the chest pains. Massive difference. So I was worried that they'd set the machine wrong and I was going to have to do it again. But nope. Yeah, so huge improvement. I can't, yes, it really is. It's amazing. The difference is brilliant, folks. Go and get it done. So yeah, I've just got one more test to do, and that's the CT scan, where they put some dye into the wrist again, and they just take some scans of the arteries to see what's going on, to I guess make sure that nothing else has changed, and that'll all whisk its way off to the Civil Aviation Authority, and their cardiologists will have a look at it. So yeah, so I've got that in a couple of weeks' time, that CT scan. But the earliest I can actually start flying again is 6 months after the operation, which takes us to February of next year, so 2025. So yeah, it's a long time not flying. Now, one final thing then, in relation to having the operation done, you'll need to notify your car insurance company or your motorbike insurance company, and it's just a medical change form. They do it over the phone, or they send you it and you fill it in and send it back to them via email. So you need to notify your insurance company if you've got motor insurance, whether that be a car or a bike. In relation to holiday insurance, you're going to have to notify them as well. So I had to notify my insurance company, and all this happened, the chest pains all happened when my holiday insurance was up for renewal, and they couldn't insure me. They wouldn't insure me because they didn't know what's going on. Now they know what's going on. Very happy over the phone. Yeah, we can insure you, Mr. P. We can insure you. And it was about £160 for me, and that was all over Europe. Didn't include Egypt or America. I think if you want to go to America, that was 500 quid. I'm not going to America, so it's not a problem. So yeah, I thought it was going to be really astronomical, but no, coronary heart disease, and all the tablets I'm taking, not a problem, 160 quid. And I'll put a link in the description down below for that insurance company. I can't remember who they are, but I'll put a link in the description down below. So car insurance, holiday insurance. The other thing I would say, now we've all got mobile phones, iPhones in my case, or Android phone. Now, if you're not aware, there is an emergency section in there, which even if somebody doesn't know your code to get into your phone, you can put a load of stuff in there, which will let people know, if they know about the emergency code or the emergency part to the phone, they can read it. So when all this kicked off back in May, on my phone in the emergency section, I put in there that I suffer from angina and I'm getting chest pains, and whatever medication I'm on, who my cardiologist was, and where I was in every stage of the investigation into my coronary heart disease. So I would suggest get a family member. If you're elderly and you don't know how to do it, or if you don't know how to do it full stop, then get somebody to put that into your phone, because if you do have an incident and you pass out, then the paramedics will have a look at your phone. They should know how to do it, and they will see, oh yeah, Paul, coronary heart disease, he's been investigated for it, this is a medication he's on, fine, brilliant. So I would strongly suggest you put that in your phone, whether that be iPhone or Android. And now I've had the operation, the emergency stuff in my phone is all up to date with all the medication that I'm on. So if I have cardiac arrest, or I'm walking down the street and the left side decides to pack up, the left main stem decides to pack up, or I get chest pains, or I have a heart attack, then they can pick my phone up and they know what's wrong. Well, they've got a good idea and what medication I'm on, because I'm on the cloppy, whatever it's called, the blood clotting tablets which stop the blood clotting. Then if you get a cut, then it doesn't stop bleeding as easy if you weren't on the tablets, whether that be aspirin or whatever, or the cloppy, whatever it's called. So yeah, put that in your phone. Folks, that's it. It's a long video, but I just wanted to help anybody out there that's going through the procedure, was about to go through the procedure. I think that's it. Have a look at part 1. That just tells you all about cholesterol, angina, heart attacks, and all that kind of stuff. Yeah. Part 2 is all about the procedures and how we get to sorting it out. So as I said, I'm not free of coronary heart disease. I've still got it, and a bit of a lifestyle change. I hope the video's been of some interest to yourselves. I've enjoyed kind of making it over a 3-week period. Yeah, I'm fighting fit, raring to go, busting stuff down the gym, walking the dogs, no pain at all. Yeah, that's it. That's all I've got to say. Thank you very much for watching. If you ride a motorbike, ride safe, and yeah, take care. Cheerio. Bye-bye. I'm going to go down the gym. Bye.